Welcome, everyone. This is Pam Dunwald with Your Nurse Advocate Consulting, and welcome back to another Tuesday Tips. Now, before you click off, or before um, stop the replay, if you're watching this on our YouTube video, just hear me out here, because I know we're going to talk about transitions in care. And yes, that is a medical term. That is a term we use in healthcare. But I want to explain that to you, during this Tuesday Tips, because it is critical to having a transition in care, which we're going to describe that when you're all right. Let's jump in here, because I don't want to lose you here. So a transition in care is when, say, your aging loved one goes from the hospital, or from home to the hospital and then back home. That's a transition in care. A transition in care could be something as simple as going from home to the doctor's office and then home again. A transition in care is moving from one level of care to another. A bigger transition in care would be, say, a loved one going from home to the hospital, then to the nursing home, and then back home, or to home, to the hospital, to a nursing home, then to assisted living. So the more transitions, the more changes there are, the more room there is for errors in medication, errors in treatment plans, things not being communicated from one transition to another. And it is by far the most riskiest time that your aging loved one can have in the healthcare system. And that's why it's super important. So stay with me if you want. We're going to discuss some ways to make successful transitions. We're introducing this topic for the month of October. We're going to be focusing on it quite a bit, because it is a big deal. And towards the end of the month, we'll talk a little bit more. We're going to have a little workshop. We're going to have checklists for you to cover each one of those transitions. So you'll have a little checklist to help you make sure that those transitions are going smoothly. So please, stay with us if you're interested in how you can make a successful transition. So let's go ahead and dive in a little deeper here. So caring for an aging loved one can really be, challenging yet a rewarding experience. So one of the most critical and stressful times for caregivers is when their loved one transitions from one type of care to another, which is what we were describing. So mistakes during these transitions can lead to confusion in care, medication errors, and even hospital readmissions. And that's the last thing that you or your loved one wants, is to be discharged home from the hospital only a few days later to go back. So the more transitions, the more complex and the more complexities that are involved. So crucial information can often be missed in communication. So I'll give you some examples. Now, 40 years as an RN, worked in all kinds of settings: emergency room, uh, home health, hospice, acute care. Lots of all those places that I worked in involved transitions in care. Even something as simple as a patient going into the emergency room, from the emergency room to the floor. Now, something as simple like that, that's another transition. A lot of things can happen when a patient goes from home to the emergency room, and then for some reason the patient needs to be admitted. Sometimes that patient isn't in the best of condition to be able to give them a good medication list, especially if they're out of town and they're not accessing, the online records. It's a different system, so they're not talking. So sometimes the medications that are reported that the patient takes is what they can learn in the emergency room 3 days later, 2 days later, a day later in the hospital, when finally family are here and trying to pull things together. We find that the medication list was not complete, that there are some missing medications. So maybe that patient hasn't been getting those medications in the hospital because the emergency room wasn't able to get the complete list at that time, for a lot of different reasons. So, that's an example of transition. So let's take your aging loved one that goes to the hospital and then to the nursing home. Now, depending on where you live and what the process is, I can tell you it's very common in our state for nursing homes to accept the doctor's discharge summary as orders for the nursing home. Now, the nursing homes, they like to get their orders Johnny on the spot as quick as possible so they can get the orders going on their end, so that when the patient, comes over from the hospital to the nursing home, they got a head start. They're getting the orders done, they're getting the medications, ready of what they're going to use. So I can't tell you how many times that we've sent over the discharge summary, which has the doctor's summary of the care, the current medication list, the current orders that are going to be carried out at the nursing home. Well, that gets sent, and then 15 minutes before the patient is ready to leave for the nursing home, something gets changed, or a pharmacist talks to the doctor, something gets changed, a treatment, something gets changed, and that discharge summary doesn't get updated and a new one sent over to the nursing home. So now what's just happened? Right there, the patient hasn't even left the hospital yet to go to the nursing home, and there's already been we're not sending the complete information over to the nursing home. So a discharge can be very complex and very tricky. There's a lot of hands in the pot. So it's very, very critical, I would say, that at any time your loved one is going to the hospital, and whether they're going back home or going to a nursing home or going to assisted living, wherever they are, someone in the family other than the patient should be present for any kind of discharge instructions from the hospital. You should have medication list from home so that you can ask questions. When they go through the discharge summary, they go through the discharge instructions. Have your list with you. Okay, well, we're stopping this medicine. Well, this medicine that they take at home is not on the list. What happened to this medication? Or this is what we were doing at home. Are we not doing that anymore? So a lot of things can change, especially when you go into the hospital. Most likely nowadays, most hospitals have what they call hospitalists. These are doctors that just see patients when they come in the hospital. Long gone are the days when your doctor did rotations at the hospital. Now, that might be still the case in some areas, but it's not the norm anymore, where your doctor is going to come in every day and see you, and this is your primary care provider that you see all the time. That more likely won't happen. You'll see a hospital, so you see a doctor who his job is just to take care of patients that are in the hospital. And so they don't know, your loved one like their primary doctor does. And so someone has to advocate for them to make sure that all the changes get communicated, that you understand the medications that are being changed, or the treatment plan or medications that are being stopped. It's happened so many times where patients leave the hospital and they think that they're taking the medications in the hospital like they're supposed to. And then they go home and they start taking everything like they used to take before, and disregard any of the changes because they thought that that's just what they were doing in the hospital. So I can't tell you how important it is. I'll give you another example. We had a patient that was started on some blood thinning medication. Now, the newer medications, the Eliquis, the Xarelto, the doctors like them because you don't have to do ongoing blood tests and check your INR for when you're on Coumadin or warfarin. It's once you start taking that, you're therapeutic, and they don't have to monitor blood work in that. So it's real convenient. The problem with those two medications is they are not a generic medication like warfarin or Coumadin, which is very inexpensive. These new drugs, that are under patent, these name brand drugs are very expensive, and your formulary for your insurance, your Medicare plan may cover one, but may not the other. We had a patient where her husband was discharged. She did not come. He had some dementia. She did not come up to the hospital to get the discharge instructions. She just called up and said, "Okay, I got the car in front of the hospital. Could you bring my husband down?" So the nurse took the patient down. She went over to the local pharmacy to pick up the medication. And when she saw the copay of $350, she refused. She declined to pick up the medication. So he went home and he went home and did not have his blood thinning medication, which would be very important. He could, have another blood clot. He could have a lot of complications. And we didn't know this until 48 hours later. Us in case management, we identify some people as high risk. So some of these people will make phone calls home and just see how it's going. And we kind of review the discharge instructions. Well, we found out that she didn't pick up the medication. So now he's gone, 2 days without the new medication. So now we got to figure out what we're going to do to correct that. So it's really, really important as far as, making sure that you understand or that you're questioning everything. And it's okay. Long gone are the days where, if they're, a healthcare provider and what they say, you just take for face value. I mean, we have to be educated consumers. It's okay to question them. It's okay to ask questions. It's okay to advocate for your loved one and make sure that you understand. Ask how much these new medications are going to cost. The pharmacist at the hospital, they can help you, or you can call your retail pharmacy, where you get your medications, and ask them, say, I've got a new prescription that's going to be called in. What's my copay going to be? Look on your formulary for your Medicare Advantage plan or your insurance plan. See if that drug is even listed as being covered by your insurance. We need to really take a proactive approach, because if we don't, no one's going to watch out for our loved one as much as we are, as much as a family member or someone who's advocating. Or that's where we come into play too, as a patient advocate. We can come alongside you and make sure some of these things are taken care of and are addressed. So it's very important to know what was going on with your loved one before they go in the hospital. Be aware of what changes are. Here's another thing that you can ask for. If there's a lot of things going on and things seem to be going really quickly, they're talking about discharge within just a day or two, and things are happening so fast, and you feel like you're overwhelmed and not keeping your head above water, ask to see the social worker or the discharge planner at the hospital and say, hey, this is a lot for me. This is too much too fast. Can we have a care conference? And what a care conference is the social worker or the discharge planner will arrange it. All the disciplines, including the doctor and providers that are involved in the care, will come together in your loved one's room in the hospital, and each one will discuss it. And it's your opportunity to meet with everyone and ask questions. So don't hesitate. That's your right. And don't hesitate to ask for a care conference so that everything can be spelled out and that you have all your questions answered before you're feeling like your loved one is being rushed, home. And that is the thing, it's to look at it from the back end. Hospitals are under a lot of pressure from the insurance companies to be very efficient, and they look at criteria, they look at diagnosis, how long, the insurance companies, there's, for every diagnosis, there is criteria that needs to be met for a hospitalization, whether they're in just a 24 to 48 hour observation outpatient bed, or if they are a full inpatient, which the insurance company, may pay at a different rate. So a lot of things happen fast in the hospital and people go home rather quickly. And so it can be very, very overwhelming. So you want to make sure that you're prepared to be the advocate that you want to be. And so this month we're going to be, looking at all the different kinds of transitions. We're going to look at general considerations for transitions. We're going to be looking at home to assisted living. We're going to look at hospital to home, and then to home with home care. When you go home with services, who's making those arrangements? Are you expected to call the home care company? Is the social worker, the discharge planner, making that referral and getting that initially set up? Who's handling all these things? We're going to be talking about independent living to memory care, hospital to nursing home, and then back to home. Again, that's 3 transitions, so 3 opportunities for errors to occur. And then we're going to look at, even home to doctor's office. I mean, if your loved one maybe has dementia, or maybe they're they're a little forgetful, just normal aging forgetfulness, and they go to the doctor and they come home. Do they remember everything that the doctor discussed? Do they understand about their change in medications? Are they going to pick up their script? I mean, it's always good for a loved one, someone in the family, with their permission, because it's a privacy thing, but asking for permission to have access to your My Chart. You could look at their appointments, you can read the doctor's notes, you can look at the lab and the test results, and it will really, really help you stay on top of things in trying to help manage the care of your aging loved ones. So we're going to go ahead and we're going to stop this here today, because there is a lot, but I wanted to take this opportunity for this Tuesday tips just to give you an idea of what transitions in care are and why they are so important and why it is a critical time in your aging loved one's healthcare journey. So with that being said, we will see you next week at our next Tuesday tips. Have a great evening and take care.